February is Heart Month, and we're learning that when it comes to heart health and cardiology concerns, problems and often even symptoms of trouble can be very different for women than for men. Dr. Heba Wassif from Baystate Medical Practice's Northampton Cardiology Office sat down with me to talk about it. Full disclosure, Baystate Health Systems is an underwriter for Connecting Point.
I'm glad that this is coming to attention now, because for many years, even physicians were not even aware that heart disease is a problem of women, and it's not only a man's disease. And a survey that was done many years ago, in 2003 or so, they asked practitioners what do they know about heart disease, and they found that only 1 in 5 practitioners was aware that more women die of heart disease compared to men. And therefore, there have been multiple efforts to take on this issue and bring it to the public's attention. Campaigns like Go Red for Women campaign and Heart Truth campaign, and multiple others. The Veterans Administration has put forth a campaign for women's veterans. And these efforts are becoming very fruitful, and we're seeing change in the perception of heart disease in women, and people are becoming more aware of it as a problem. So, for example, 20 years ago, even women were not aware of their risk. Only 30% of women were aware that heart disease is their #1 killer, more than any other disease or cancer, including breast cancer. Most recently, that number has gone up to 56%. So we have come a long way, but we still have much more room to improve. Still, 44% of women are not aware. There are disparities between Caucasian women, African American, and Hispanic women. So 65% of Caucasian women are aware of this risk, while as 36% and 34% respectively of African American or Hispanic women are aware of the risk.
Let's talk about one of the things that I was concerned and surprised about. The symptoms of a heart attack can be significantly different in a woman than a man. So for all these years she's seen the advertisements or the public service announcements, what to watch out for, that may not do her any good. A woman needs to be uniquely aware, and a woman's physician, I guess, too, of what may present in terms of heart attack symptoms.
Absolutely. So women do present with chest pain. Let's get that right. I mean, they do present with chest pain, but they also present with a lot of other symptoms that men tend not to present with. And one of the common symptoms is stomach pain, or epigastric pain as we call it, heartburn. Particularly African American women, they present with heartburn. Other symptoms such as nausea, unexplained fatigue, shortness of breath, breaking up in a cold sweat, dizziness, all these symptoms that women have to be aware of. And especially if they are high risk, they do need to be involved and be more proactive about going forth and contacting their providers.
I was also interested to read, one of the reports I was reading preparing for this discussion, that younger women in particular, if they have a heart disease, if they have a heart attack, the chances of a first heart attack taking their life is much greater than in men, young women particularly.
We are seeing that trend, that is very true. Young women in particular, the death rates are much higher. And it's not quite clear why that is. Maybe part of it, and this is only a partial explanation, that women tend to present late because they're not aware of their risk. For example, young women, less than 6% of young women are aware that cardiovascular disease is a big risk for them. They tend to present late, at least 22 minutes or so later than men. So there are differences that we're not all that clear about.
Another difference that I read about, simply anatomically.
Absolutely.
In most cases,
Absolutely.
women are smaller, veins are smaller, they may clog more easily or differently. Again, I guess something everyone from the medical professional to the potential patient has to keep in mind.
Absolutely. So there are anatomical differences. Not all vessels are created equal. women have smaller blood vessels, but they also tend to have disease that doesn't completely block the artery. Whereas men tend to present with complete blockage of the artery, women tend to present with either no blockage in the artery or partial blockage of the artery. And they also tend to have more disease at the smaller blood vessels, what we call microvascular angina. In addition to that, also women tend to have other forms of problems with these blood vessels. They are more prone to tear in the blood vessels, a dissection, or they're more prone to a spasm in the blood vessel, which can also cause chest pain and angina and heart attacks.
I also noticed that women often are older than men when they have a heart attack, and often they come in, there are other conditions which may mask or complicate diabetes, high blood pressure.
Absolutely. So in the past, and though that remains somewhat true today, women present 10 years older than men, so they tend to have more problems, medical conditions. They also tend to die much more than men within the first year after they've had their heart attack. So that's probably related to the comorbid conditions that they're suffering from.
Do we just need to completely kind of change the way we think about women and heart ailment and illness?
Absolutely. It's a woman's disease, and it also impacts a woman across the spectrum of age. It's not a disease of older women. It is a disease of young women as well. Women who are pregnant and suffer from illnesses such as preeclampsia, hypertension, and diabetes during their pregnancy are very likely to develop cardiovascular disease during their lifetime. And they will likely to present at a younger age, of course. So it's a changing paradigm, and we have to be all aware of it, both patients and providers.
When a woman, not necessarily presenting any heart or cardiovascular symptoms, but when a woman is going to her primary care physician, the annual physical or the checkup, what does she need to be aware of? What does she need to be saying to that physician to make sure that she's getting the heart tests or the heart checks that maybe just wouldn't happen otherwise?
She needs to know what her risk is. Is she high risk? Is she at risk? Is she ideal risk? And there are ways that the physician is able to do that. And she also needs to know what her numbers are. She needs to know what her blood pressure is. She needs to know what the cholesterol level is, the good, the bad, the triglycerides. She needs to know what her glucose is. She needs to know what her waist is and her body mass index. And these are all important numbers that a woman should know about her health.
Well, Dr. Heba Wassif, thank you so much for what you're doing, and thanks for coming in and spending some time with us.
My pleasure.